Quick disclaimer before we begin, the PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. Welcome back to another episode of the PEMF podcast. And our guest today is founder of a training called AOPP, which we'll come to. And if you've ever opened a PEMF clinic or if you're using PEMF on people, you probably would have come across this company. But Jerry, I'll let you introduce yourself. And if you could just tell us a little bit about your background in medicine and how you started all of this.
You bet. Thanks, Andy. My name is Dr. Jerry Dreessen, and I am with the Association of PEMF Professionals, the organization name. I'm a practicing chiropractor here in the state of Washington in the United States. And I've been in practice over 35 years. And once I found about PEMF, I did a little diagnostics on it as far as what this is all about, but I've incorporated it into my practice. And now I am using it on a daily basis. But as we'll kind of get into it, the whole field of PEMF has just exploded over the last 10, 15 years. And we wanted to make sure that we had it set up, or I don't want to say the word regulated, but to have best practices in place for people that are using this, not only on themselves, but in a medical setting or in a business.
How did you find out about PEMF therapy? Where did it all begin? So take me back to, the first time you saw a device or used a device and then it went on to this pathway.
I'm going to say it was probably 2010. Mm-hmm. I was part of a mastermind group. In that group was another person, Pat Seamer, mm-hmm. and he had gone to this event. And he said, "Jerry, you got to take a look at this device. It's amazing." And I said, "What is it?" Mm-hmm. He was explaining it to me. And I have a very high skeptical personality. It's like, okay, what is this really? What's it all about? And I saw a video of a guy standing at pasturing, and he was holding this giant double loop, just standing there, mm-hmm. and it was clicking, and across the pasture came this horse, and it walked right up next to it, and it wasn't touching the horse, and its flank was pulsing. Mm-hmm. And that just blew my mind because, having come from background physical therapy, if you're doing stim or something like that, you've got these pads attached, you got this cross system going on, and it's, shocking the muscles, causing that. And it wasn't doing any of that.
Yeah.
It's like, what is this? What is this voodoo? And so Pat ended up, buying the company and sent me a unit. He goes, "Check this out. Tell me what you think." And then that's why I started studying it. I started studying about, how it was Earth's magnetic field, and that was amplified, and just the whole series on getting our body, grounded and getting the right types of frequencies, because that's really all we are, is just a bunch of frequencies. But if you can use that for healing, and how it stimulated the Krebs cycle all the way down to mitochondria, nitric oxide, it's just way down into the geeky science, all biomechanics, biology kind of stuff. So when I got the device, I told him, I said, I put it on all my old high school football injuries. Mm-hmm. Because I had shoulders, I had knees. And after I was done, to have full range of motion and no pain, it's like, okay, this is legit.
Yeah.
And so that was kind of how it all started. I jumped on board with Pat at MagnaWave and helped them put together the human course. And then the both of us realized it's not just his company. There's all these other manufacturers and all these other people that have these PEMF devices. And that's when I told him, I said, we need to take this literally globally and create certifications for all of these things. Because if we don't do it, somebody else is going to come in and, put the hatchet to it and do a poor job of it. So that's why we started the national organization, and then I went with that. So that's how the AOPP was born. But my engagement with PEMF device, that I would go out and go to a powerlifting competition.
Mm-hmm.
And right after somebody lifted, I would put the PEMF device on them, and they would stand up and they would look at me and they go, "What was that?" Because the soreness that they usually have after the event was totally gone.
Yeah.
Some guys' hands were like really messed up because they like pulling carpet and put it on their hands right afterwards. They're like wiggling their fingers. Like, what happened? And so just to see these things happening, my favorite one was the guy that just got his tooth pulled and his jaw was all swollen. And I so mad at myself for not filming this, but we put it next to his jaw, and over 5 minutes, swelling went down.
Yeah, it deflated like a balloon.
Yeah, and it's like, okay, nobody's going to believe me because I should have filmed it. And it's like, why didn't I?
So who's exactly for the courses for? So who would generally sign up with you guys and would be looking for this type of course?
So there are 3 categories, really. There's like, some people are like, what is this PEMF thing all about? So we have this general course, and people can, it's part of our continuing education part, and they can learn kind of in a nutshell what PEMF stands for, how it's designed, what the history of it is. Once they get started and they want to learn more about how they can use these sessions on humans or animals, we have 3 courses. There is the human course, certification course. There's the small animal certification course, and then the large animal or like equine. And each one is taught by an expert in their field. And so when people go through these courses, they consume all of the coursework, and then they take a test. And then once they've passed the test, then they get their certification in that particular coursework.
Is it required by law to have a certification in PEMF therapy to use it on other people?
It is not required by law. This is what's great about PEMF is that it's magnetic, and it does not have to actually touch somebody. So it's not an electronic device. That was one of our first questions too here in America is this a physical therapy device? And physical therapy devices are electrical that touch the skin. They're ultrasound that touch the skin. They're, these modalities that require this certain certification medically in order to use these devices, whereas PEMF doesn't fall into that category. It's not a physical therapy device. And anybody can buy one. Anybody can use one. We had a similar problem back in the 70s with being regulated as chiropractors talking about nutrition. And our argument was, I could go to the local store and ask the person putting vitamins on the shelf which one would be best, and they could tell me. And they didn't have any kind of degree at all, yet here they are giving nutritional advice, whereas we've actually gone through schooling and taken tests on nutrition, and yet we were prohibited from talking. And so that was kind of the nidus of how we got all of this put together too. So anybody can buy a PEMF device. They come in different sizes and strengths, and people can use it on themselves. They can use it, on all kinds of different things. But how to use it, best practices, the pre-treatment, post-treatment, or sessions, that is why we jumped in and created this coursework, is so that people could get certified to prevent some outside group coming in and regulating all of this. So that was our back when we started this.
No, so it's a really important point because, like you say, the PEMF therapy is generally a very, very low risk therapy, but the biggest point from you guys is still applying it correctly to get the most out of your sessions and to get the actual results. So no, I think that's a really good idea, and what you guys have put together is really strong. So can this be done completely online, or how do the courses actually work?
So this is all online. It is a series of recordings and readings, and you go at your own pace, and then you take the test, and there's a certain percentage you have to pass by, and if you fail the test, you can retake it, but you can go back into the coursework and review it. So we want to make sure that everybody, basically passes with an A. Versus, just reading two or three things and checking a couple of boxes. It's a really good set of coursework that we have.
Yeah, cool. So being online, does that mean that this can be accessed globally? Is there any kind of limitations to this, or can people use this anywhere?
Right. So the certifications are set up so that they're globally. We're actually in 17 countries as far as PEMF and the people that we work with. So it is designed to be available to any organization that wants to use it, any person that wants to use it. It's not an American thing. It's designed to be global.
Mm-hmm. Yeah, cool. So, I mean, we're on a 9-hour time difference at the moment. So thanks for getting up and joining this one. So we're in the UK and you guys are in the US. Through NewMed, we do offer a hands-on course, but obviously the UK is a lot smaller, and logistically that kind of works a bit better. But are you guys thinking of doing any kind of hands-on training anytime soon, or can you offer anything like that at the time being, or even one-to-one training?
Well, Andy, that's one of the things that we want to be able to do, is to have coursework set up so that there's hands-on. And there are a couple of organizations that make and produce and sell PEMF devices that have like a once a year, people can come and get hands-on, and that's where we want to head to. Our goal was to grow the membership, get it so that we're at a large enough reach so that we can have people come into a central area so they can get all the hands-on training and things like that too. I would say we're in a nutshell. If anybody wanted to travel to Washington State and hang out with me for a day, they could get hands-on training too. Yeah. But we want to be able to do it like in a central area. And I've done this before too. I've gone in with one of the other companies and taught hands-on, and it's invaluable information that you can get when they can actually be there and ask questions as they happen, and to kind of be side by side with me while I'm showing what to do and how to work through some of these session processes.
Okay. No, good. So what do the guys get from completing the course? You mentioned an accreditation, but what other benefits can come with it? I've seen something about a map on your website. Do you list the people that have had the training and where people can find them, and what else comes as this package?
On our website, there is a national map. Now it's international. We've upgraded that system, so you can find a PEMF professional, certified professional in your area if you're looking for one. So there's that. That person gets to have their name and information on it as well, and like a backlink to their website, so people can like jump over to their website if they have one. As a member, we have a very reduced fee website if somebody wants one. They don't have one, which will create one for them. But the other thing is they get a certification. It's a frameable certification. They get to use our little logo bug that they can put on their website. They can add it to their business card, so they can promote themselves as being, internationally certified or nationally certified, that they've gone through some kind of training. So again, it's a gateway to be able to reach like the professional level. So somebody who just has a PEMF device, somebody who's gone through certification, they knock on the door. Let's say here in America, they're going to work with a vet or a chiropractor or a naturopath. They've gone through the coursework. They actually know how to, approach patients or people and walk them through protocols. So they have all this knowledge, which I think makes them be able to build their business better and stronger.
Yeah. Okay, good. Will the course help people get more clients? So if somebody takes a course, obviously they get the knowledge of using PEMF therapy, but can they maximize their business at the same time?
That's a really good question. One of the things we have inside our membership, once you become a member, there's a huge list of other things that you can consume. And one of them is, I think we've got 3 videos out now, or 3 courses on how to build your business. how to build your PEMF business, whether it's with humans or whether it's with small animals. So we've had one of our top vets talk about that. We've had people with their own success stories where we've interviewed them, and that's on the inside. We have a social media expert talking about how to go about doing those things. And then also the whole goal is to, now that you have this certification and you want to go out and you want to do something with it, here's how to go about doing it. Here's how you can, knock on the door of the chiropractor. Here's how you get past the gatekeeper. Here's the buzzwords that you need to say when you're trying to present yourself in front of healthcare professionals to maybe come in and work with them on site or invite their patients to come and see you a few times. So that's the thing we try and cover. Again, we're really rich on people contacting us saying, hey, how do we go about doing this? And if we get enough questions along the same line, then we'll create a video that covers it.
Good. And insurance is another thing that we kind of come up against in the UK quite a lot. People will open a clinic and they have to have insurance, if anything goes wrong with their clients. Does just having the training and accreditation help with the insurance process?
Again, having some kind of insurance, like a malpractice insurance, sets you above your competitors, but again, also protects you because you don't know, anything crazy that can happen, and so you need that protection. And we've actually partnered with an insurance group that specializes in insuring people that do PEMF. And when we first started this, people were like, well, what's PEMF?
Right? It's the problem we have in the UK quite often.
Right. And so, that was, 10, 15 years ago. And since then, there's a couple of insurance groups that now that they've seen it, they know it. We have it here it was in the Olympics. It's in our, NFL sports football teams, all our professional sports teams use it now. So it's integrated inside our system enough so that everybody knows what it is. Whereas when I first started, I was like the only person in my state to even have one. Okay. And that was so strange to have a device. It was really well known over on the eastern side of the United States. So to be one of the first people to kind of crack the state, so to speak, and begin to use this. Again, I had through my malpractice insurance coverage, but for people that are just starting out, there are now 2 or 3 different insurance companies that know about this. And if you are a member of our group, then you be in contact with those insurance companies.
Oh, good. So you said before the insurance companies actually knew what PEMF therapy was. Is there, I don't know if you know the answer to this one, but is there like a classification that people can put that into, like, magnet therapy or electrotherapy, or is there some kind of category that they can kind of describe to the insurance companies that helps? Anything that, you can bring from your experience?
At its basic, PEMF is like a massage device. It's just that it's not touching you and it's not massaging you. Because the magnetic pulses make the muscles twitch. But we avoid using any terminology like electric or electronic. We want to get that word out of there, because when you say something like that, now you're dropped it into a physical therapy classification.
Okay, no, that makes sense. So you'd almost call it a massage bed that assists the therapist.
Yeah, it would be like a G5, which is a type of massage device. Or we call it the Thumper 5000, but the hand guide massage units. Those kinds of things.
Oh, brilliant. And the courses, are the courses just for humans, or do they cover animals or equine, or how far do we take the courses?
The coursework is divided into 3 components. So we have the human side. So it's all about not only how to apply PEMF, but the questions to ask beforehand, the things to measure beforehand. You're creating what we call a SOAP note. So it's subjective, objective, action, and prognosis, or what your next session is. So it teaches people how to do all of that. So how to be organized. And so when you're working on, if you're doing this as a profession, if you're working on people, you keep a file on them, and it teaches all of that too. It's like, how do you treat a foot? How do you treat a shoulder? How do you treat PTSD? How do you treat, bladder or bone break? So we go through all of those different things that PEMF is known for, but also the pre-treatment, the treatment, the post-treatment or session. I swap back and forth between session and treatment, because as a doctor, I can say treatment, but as a non-doctor, you have to say session. That's the how we say it here in America. So forgive me if I bounce back and forth from those. But the next certification is small animal. So it's, it's work dogs, it's any kind of animal that's on a farm. So there's like, cows, there's the horses. So now you're dealing with the larger animals, which is the next certification. But a lot of people have it's usually their pets, cats, dogs, but there's pigs, there's goats.
Okay.
Now, with the large animal side, again, it's how do you approach these animals? How do you have a business where you're working with small animals and learn to deal with small animals? And most people have their own small animals, and they just want to expand what they're doing and help other small animals. On the horse side, the equine side, that's a huge, business, especially here in the Northwest. We have race horses. Down in the the South, East South, there's horse races, and so that has been a big factor on helping animals heal, or that's what's great about it. It's not an analgesic. It doesn't numb things. It just makes things better. They are better. And to learn about that, and then when you are doing a session like with a horse, for example, where do you start? What's the best practices? We have one woman. In fact, I have this picture in my office to show people that celebrities use PEMF, but it's a grizzly bear. He's laying down. He's got the big wings on his shoulders, and he's having PEMF done. So how do you go about treating a grizzly bear, right? So anyways, the certifications, it's designed to cover A through Z, how you deal with a human, A through Z, how you deal with small animals, A through Z, how you deal with large animals.
Okay. This is quite recent actually, but we saw a news article about the equine industry recently, and there's maybe 3, or correct me if I'm wrong, there's a few states in the US now that are making it a little bit more difficult to use specifically PEMF therapy, is it? Or is it a number of different therapies? But seems to be clamping down on PEMF treatment and horses. Is there any kind of context into what's happening with that? And does that mean it's going to get more difficult to use it? Or
I'm going to say this right. I think that the restrictions that they put on, it's just this 2 or 3 different states, the veterinarian boards put a restriction on it, but it was based on ignorance.
Okay.
And they saw these people doing PEMF on, horses and things like that. And again, jumping into the certification side, you learn the language to use. And I think they saw people using PEMF that weren't certified, that were making these promises, or talking about how the device works when it wasn't how it works. So they were saying, well, we can't have these people doing this. We only want to have vets doing it. And come to find out, the vets are like, we don't have time to do this. Why did you do that?
Yeah.
Why did you say that we were the only ones that can do it? Because we don't have time. And so the burden is on their shoulders. And so that's kind of what they're dealing with now too. And they know nothing about our national organization and certification. And so we have been calling them, emailing them, saying, hey, look at what we're doing, what this is all about. And we're just getting crickets. So I think, again, this group did a knee-jerk reaction. I think if I were on the board and I didn't know anything about PEMF or certification of it, I would say, we've got to protect the animals, because we don't know what this is all about. So I think it was just kind of a knee-jerk reaction to start with.
I
I don't know, the conspiracy theory is there was a vet that was really mad that they weren't the ones getting all the business for PEMF. That's just, that's just a rumor. But again, it's just a group of people that need to be educated on what this is all about. And we're knocking on that door to educate them so that they realize this has a purpose. It has a great system that's available. And again, once they realize that it's not an electrical modality, it's not a surgery, it's not something that requires, to have a degree or a teaching in how to deal with those kinds of things. Again, somebody can go buy a PEMF device and put it on their dog, and they can put it on their cat. But as soon as they pick it up and they put it on somebody else's cat, or somebody else's dog, now they're in violation, and it doesn't make any sense because it's just a different animal. The person's animal, the person that owns it says that it's okay. But if you have, again, jump back into certification, if you have the right protocol, everything's in place, you have like a premise insurance or malpractice insurance, all of those things, then nobody can be harmed. Or if I can't even think that, as far as using these things, how a PEMF can harm somebody if you're not following all the protocols.
Yeah, exactly. I mean, I've been involved in PEMFs now for 10 years and I still haven't heard of any kind of real issues with anybody using a device on anybody, even at the higher intensities. So, no, that's good. Tell us a little bit about your Back to Action Chiropractics. What's all this about?
Well, it's my flagship business. I was in practice originally with my dad and my brother. There's third generation chiropractor, so I have a grandfather, an uncle, a father, a brother. We are all in the chiropractic business, and then I jumped out on my own and started my own practice, and I've been doing that for 35 years.
Oh, amazing!
And
so, what do you offer? What do you offer there? Is it solely PEMF, or are you offering lots of different modalities there?
So, state of Washington is one of 2 states that prohibit chiropractors from using physical therapy.
Oh.
So, if you were in Oregon or California, you'd be doing all the physical therapy stuff. Ultrasound and all the electrical modalities, things like that. So, in my practice, it's subluxation based, so we're adjusting the joints and reconstructing and correcting vertebrae for car accidents. It's a family practice where we're doing subluxation based treatments, and then I bring in nutrition and PEMF and some rehab work, wobble board, things like that.
No, good stuff. So it's quite good that you're running the training sessions, but obviously, or the training courses, but your day to day is treating people as well. So you know firsthand exactly how to navigate this industry, and every client's response to PEMF therapy. So what do you predominantly use when you're using a device? Do you use kind of like higher intensities or lower intensities, or a combination of the two, or what do you prefer in terms of?
So I have the large machine. I have a 2.1 Tesla, and so it's the Big Bertha, but I use various settings. I still have the analog dial.
Yeah, okay.
So I can set it to whatever strength I want it to, and I have little ladies with chronic joint disease, and I have athletes that are pole vaulting and throwing javelins. So it's a wide variety. So I have a pad that people can sit on. I've got a large loop people can put around their neck or around their body. I've got the small double loop that we can focus on a certain area. I've got a couple of people with breaks that were in their bones or using it to help heal the bones on them. So it's a wide, and I love it. It's a wide variety. So I don't really focus on a specific area. Car accidents, people come in and I'll have them put it on their body to start out with to help shrink the swelling of an area and begin to heal it faster.
Okay, cool. PEMF-Con. There's a rumor going around that there's a show going to be released, or a conference, PEMF-Con 2024, and that's involving AOPP. Can you give me a little bit of insight into this one?
this will be our second one. This year it's October 16th and 17th, and it's online.
Mm-hmm.
Our goal is to have that in person as we grow. We are inviting all walks of life that are interested in PEMF to come be a part of it, and they can go to our website and see that and join it and become a part of it. We have some really good speakers. We have some breakout sessions where people that are going can talk with them, one-on-one and ask questions. It's all, like I said, it's all online. And as we develop this, we'll have the whole lineup set up. I can't say who's going to be there yet. We don't have the final confirmation on people.
And is that for just people that want to set up a professional setting with PEMF, or is this for any walks of life in the PEMF industry?
Anything PEMF.
Yeah. So,
any and all things PEMF.
So someone wants a PEMF device for home, they can come to this conference and they can talk to people about devices, they can get a good advice and all that sort of thing.
Yeah. We have like a vendor's spot where people can go and look and see companies that make PEMF devices. We've invited everybody. So in fact, if anybody watching this podcast that has a PEMF manufacturing company and they want to present their product to this, get in touch with us because we've got a spot for you. But we want to open it up for everybody.
Yeah.
It's even the small, handheld devices to the large ones like what I use. But we want the more PEMF that we can get in this convention, the better, because we want it to represent everybody, even those that are in other countries, to come in and be a part of it too.
Yeah. And we'll be there as NewMed and representing our Celerate brand. So we'll be there to answer your questions about anything Celerate. And just taking something from your website and from your kind of ethos with AOPP is what what we like to see is that it's unbranded, unbiased, and science-based PEMF education. So it's really the same sort of journey that we're on at NewMed is trying to raise awareness of PEMF therapy. So we've been trying to do it in the UK for many years, and it's an uphill struggle, I can tell you. But the minute people start using PEMF and understanding PEMF and seeing the benefits, we're just waiting for that boom to happen. And someone said to me the other day, they think that PEMF therapy is going to be, one of the only modalities in the future for treating chronic illnesses like cancer and stuff. And I truly believe it. So, I wanted to thank you guys for everything you're doing, and just keep up the good work. So, Jerry, where can people find you if they want to contact you about either the course or if they have questions for you? Where's the first place to start?
So there's PEMFprofessionals.com. That's the national organization, the Association of PEMF. And if they want to jump on Facebook, they belong to that. They can jump on, and we have our Facebook group, so the Association of PEMF Professionals there, and they can drop in their questions at that point. On our website, there's a couple of email contacts that they can use. You can always contact me at drjerry@gmail.com and ask a question directly that way too.
Amazing. We'll put any of those links underneath this episode so all our listeners can find you through those links. So thanks again. Anybody that's listening, any of the social media platforms or any of the platforms you're listening on, please like and share and subscribe to these so that we can get more amazing guests like Dr. Dreessen. Thanks again for sharing your knowledge and joining us today.
You're welcome, Andy. Thanks for having me on board. And it's great to be a part of this, as you know, amazing revolution of healthcare.
Yeah, amazing. Thanks again.